Well, did you know that 7 in 10 people in Singapore do not know where to seek help for dementia-related issues, while stigma towards those living with the condition remains persistent? Now, these are just some of the key findings from the latest Remember For Me nationwide survey, following earlier surveys in 2019 and 2023. Now, let's get more. We're speaking with Rosie Ching, Principal Lecturer of Statistics at SMU. Rosie, thanks so much for joining us today. I wanted you to paint a picture for all of us here today that of some of the most worrying perceptions, misconceptions that you've come across in your line of work, and how it shows up in the everyday lives of patients and their caregivers.
Thank you for having me. Well, this study has been on since 2019. It's in the third run. We just completed the third run. One of the worrying perceptions, largely on the part of people with no connection to dementia, would be the perceptions of incompetence, as well as embarrassment, as well as avoidance. So these were the highest ranking amongst the perceptions. And it is worrying because avoidance has shot up greatly from 2019. Back in 2019, it was largely rejection, shame, and loneliness on the part of people living with dementia. It has fallen starkly to about 45% now. However, the general public is on the opposite trend, where they would avoid situations where people with dementia are included. There's no right, no wrong in this. It's just simply how they feel. Because if we don't have any connection to dementia, then we don't have the opportunity to cultivate empathy for them, which is very important in this whole journey. Dementia is one of those diseases that exerts plenty of emotional, social, and practical burdens on whole family systems. Entire family systems have collapsed due to it. My own great-grandmother suffered from dementia. Back then, it wasn't even known as a disease. And there was great disagreement among the family as to her care. Some thought that she was deliberately forgetful, and others thought there was seriously something wrong. I've also spoken with care partners. They are called care partners now. And they come with stories that are often filled with a lot of discomfort, plenty of worry about their loved one, the symptoms, the signs, any worsening, and the judgment, the external judgment that they receive from their neighbors, their friends. Some get shouted at because they are perceived to be using. Let's say one of my close friends who helped me in this dementia study at the very start. She has seen her mother through the journey of dementia from early stage and now towards the end stage. So she has received plenty of stigma. It's a resounding yes from her and from plenty of other primary caregivers.
So what I'm hearing you say, Rosie, is that sometimes the emotional and psychological toll of dementia could sometimes be even worse than the actual dementia itself. So the survey suggested that these negative perceptions haven't significantly improved since 2023, as you suggested. What do you want us to take away from that statistic? Is it that Singapore is not dementia-friendly, or maybe not dementia-inclusive? I'm not sure what the correct term is for that, and that this attitude must change?
We have come a long way from 2019. Now we even have dementia go-to points at certain train stations and certain supermarkets as well. But the feedback that I get from these care partners is that it ranges from not useful to why are they even there. For example, at let's say Chinatown train station, we have these stickers, form of yellow tiffin carriers, retro telephones, and to them, and I agree, is that these reinforce the stereotype of dementia being an old age disease. And we are already a super aged nation as of this year. More than at least 21% of the population is now aged 60 or over. To navigate a super aged nation and the challenges that come with being so, we have to be up to date, with our perceptions of dementia. It's not just an old person disease.
I absolutely
but also
agree. But to know what to do next, we have to sort of know why the years of campaigns haven't had the effect. So what went wrong, and what specific actions do you want to see, particularly to the policymakers and caregivers out there?
I feel really strongly that dementia, the awareness of dementia has to start from an early age. It has to be taught in the schools from young, maybe not so much complicated medical facts, but as to how to treat one another. For example, if a person starts repeating him or herself, to pick up the signals, the signs, the symptoms of a disease in any person, whether old or young, because now there's a rise in early onset or young onset dementia in Singapore, and that can exert an even more painful cost, because these people are maybe in their late 30s to 40s to early 50s. And that's where they're still, caring for the aged parents or even bringing up children, still active in employment and navigating financial responsibilities. So we have to help these younger generations, because from the study, it was the Gen Zs, who are my students, who are 74, almost 75% of them said they don't know what to do where dementia is concerned. But these are our future care partners. They are going to be the ones caring for parents, for even, relatives or even friends.
Absolutely.
We need them to be aware, to have more empathy, understanding, compassionate in treatment of one another.
Yes, because at the end of the day, it's really not a one person, one caregiver job. It does take a village in that sense as well. Thank you so much, Ms. Rosie Ching, Principal Lecturer of Statistics at SMU, for sharing that with us.